Hello physios, welcome back to the channel, and if you're new here then I'm Shrija, a physiotherapist working in the UK, and today I'm going to show you what's inside my bag that I take for my home visit. So let's quickly begin. So if you are a new grad or someone who's going through your placements or someone who has just started with a home visit, so this video is right for you, so watch till the end. First and the foremost thing that you need before even starting the treatment is a consent form. So always remember taking consent from the patient before beginning with any sort of treatment. Whether a physical consent form or a digital consent form, doesn't matter, you need to have a consent form with you before beginning any sort of treatment. Let's go to the second thing, that is, the next thing we have here is a sanitizer. Super important. Post-COVID, I think it's very important that everyone maintains hygiene. Not only a sanitizer, but you need to carry a face mask and gloves with you if you're especially seeing any patients who has any sort of infectious disease or any post-op patient as well. Very careful, you don't want to take any sort of infection or give any infection to your patients. The next thing we have here is a pulse oximeter. So especially if you're going to do any sort of cardiac rehab or respiratory rehab, or if you're going to see any post-op patient, I think this is super important to check your oxygen level. Next thing is we have the resistance band. So I have three different colors here that I usually carry. There's an extra light one, this is a light one, and then we have a medium one. I do carry a heavy one sometimes, but depends upon the patient and the case and the history as well. The next one that I have here is inch tape. Very important for you to check if there is any leg length discrepancies, to check the girth of the muscle, and to also measure if there is any sort of swellings in the muscle. The next in the line we have a spiky ball. A spiky ball is very useful for any sort of myofascial releases, massages that you're going to do. And very quick important tip let me give you here, which I learned during my masters actually. If you take two spiky balls, or if you take two like a tennis ball or a golf ball and like wrap it together and tape it together, it will look like a peanut, which you can use as a self-release tool. So the next thing we have in the bag is a goniometer. Please to all the new physios and to one who are more professional and experienced as well, please do not assume the range of motions like, oh, it might be 90 degree or it might be 100 degree. Use a goniometer. That's what a goniometer is used for, to check your range of motion. The next thing in the line we have everyone's favorite, the stethoscope. Now, I carry this thing especially for respiratory conditions, for post-op patients as well, to understand any abnormal lung conditions and if I need to do any chest PTs or anything. The next in the line is a basic TENS machine here. I think I have shown this one in a video as well, which explained the electrotherapy usage as well. This is a basic TENS machine which you can use for pain relief. Then the last one I have here is a mobilization belt. Now, a lot of people might need mobilization, especially in post-op cases as well, or people who have frozen shoulder or any other conditions where there is joint stiffness. But other than that, a very important usage of this is to help you in patient stabilization. A lot of people, like manually, when they help the patient to do any sort of gait training or balance training or anything, I would suggest it's very important to use a mobilization belt so that you don't fall and you don't let your patient fall as well.